So right now, we are going to move into a highlight of this conference, which is our annual Innovation Awards. Actually, this is our 6th awards year. And what we do is we recognize innovations in 4 categories. And those categories are, well, you can see them up here: marketing and branding, operations technology, operations and technology, products and services, and human resources. We had this year the highest number of submissions, of nominations than ever before. We had well over 150. And there is, just so you know, there's an online platform that we use, and our judges, which are predominantly our editorial team and a couple of folks from the IFA, it's blind voting. So no one knows how the other is voted, okay? And what happens is those scoring the top 8, those that have the highest scores, are the folks you're going to see present today. So there are 8 brands that are going to be presenting. The first 4 are in the marketing and branding category. After our break, we'll come back. The second group is from operations and technology. And, you know, the whole purpose is to award and recognize brands that are trying new things, innovative things. This is not all about AI. It could be about just the best local marketing campaign, up to new innovations to recruit employees at local stores. So the nominations do come in from franchisors. I guess it's time. It's time for us to bring up our 4 finalists. And tonight you will see two of the 8 finalists that will be recognized with our overall award. There are another 20 categories, subcategories, that will also receive awards. So those folks are here, but they don't know what they're winning yet. Okay, now we're going to go to most innovative service introduction. We have Todd Houghton, who's the president of Homewatch CareGivers. And then we have Curtis Wiederin. Did I get that right?
Perfect.
I'm scoring on the names. VP of Growth and Program Delivery for Homewatch CareGivers. Gentlemen.
Thank you. Good morning. Since we didn't have walk-on music, we're going to save you from our dance, but otherwise we would have done a dance. But we are with Homewatch CareGivers. We have been in business for over 4 decades. As of this morning, we have 243 locations. I signed another agreement this morning, so that needs to be updated a little bit. But we are throughout the U.S. in 35 states, Central America, South America, Spain, and Portugal. So we are an international organization. Our thought was, if what we're doing in our box isn't working, we need to get into a new box. So we set out to look for change in how we provide service to our clients, our franchisees, to our referral sources, and to the adult child. Those are our 4 customers that we deal with. Big thing was looking through innovative technology and focused on person-centered care. Everybody is different, and in the home care space, it's always been dollars per hour for an hour of service. We wanted to set out to change that. We wanted to also focus on having an expanded life cycle for our clients. We wanted to keep them much longer than we ever had. We know through their journey prior to launching all of our new service lines, it took them about 4 to 6 months outside of a crisis situation to make the decision to have home care because mom and dad weren't ready to have a caregiver in the home. Secondly, on the other side of life, the adult child pulls mom and dad out of home care and sends them off to independent living or assisted living. 77% of people over the age of 50 want to age at home, so we had to figure out how to keep them longer at home. The big one was 1 in 4 people over the age of 65 suffer from loneliness and isolation, the leading cause of suicide amongst the aging population.
As Todd mentioned, home care is not necessarily a one-size-fits-all. And typically, the traditional home care model is that we will be in the home for X a period of time, 4 hours a day or 5 hours a day. And it's really more all about the hours. It's about the level of care and meeting an individual and matching their needs specifically to what they need. So rather than having a set amount of hours, creating the care solution that best meets that individual needs. With that, the goal and what we've seen is improved outcomes, as well as from the operator standpoint, an increased reimbursement rates, as well as higher margins for our franchise owners.
So as I mentioned, the big thing is we call it the silent epidemic. That's the loneliness factor amongst the aging population. They have profound biological and psychological effects on the aging population. Increased cognitive decline. So we wanted to figure out how do we reduce the speed of cognitive decline as we work to go to market with our new service lines and technology.
So what has changed? What we do know is that over the years, the level of care and care needs are changing. Definitely a need for technology integration to provide that care for someone's loved one when a caregiver is not physically in that home, as people choose to live in the place that they call home. We've also have seen an increased demand with the aging population continuing to grow daily. That has been a significant change, as well as family involvement. You know, family wants to be involved in an individual's level of care more than they ever have been up till this point.
So what did we do? We launched Total Care Solutions. Total Care Solutions is an end-to-end suite of services that takes care of the needs of the aging population, as well as those that are not aging that suffer from intellectual disabilities or a debilitating disease at a younger age. With our new suite of services, we've introduced what we call Active Care. Active Care is on the front side. It's a tech-forward solution that's only technology in the home that helps keep that client engaged and connected and monitored. Secondly, we changed our billing method. As we started out this conversation today, we talked that our industry has always been dollars per hour for hours of service. We now sell it as a suite of services on a monthly basis that allows our franchisees to bill in the states that they can on the front side of services, so they better understand their cash flow and what's going on for the month for them. We've also changed our frequency of visits. Virtual allows us to do more than just being in the home with a caregiver. So we do monthly care visits now with a client care coordinator or a nurse to make sure that that care plan is appropriate for the person that's in care.
Absolutely. So Todd mentioned earlier there's different customers that we have. Of course, you have the client themselves. You also have the individual's care influencers or their family members, loved ones, anyone that might be part of that care team. In addition to that, you also have senior living communities where we can make a difference in assisting individuals in an independent living community. Of course, government programs, private health insurance providers or payer sources. Family members, as I mentioned earlier, is a huge client of ours as well. We want to make sure they have the peace of mind when they may live 5 states away from their loved one. And of course, partnering with client healthcare providers as well.
So what are some of the changes in benefits? We have expanded care teams in the office now that provide top-notch care to our clients. 24/7 live availability. We've always had live answer on phones, but now it's 24/7 virtual availability to understand what's going on with the client. Improved efficiencies, allowing for us to have a single caregiver get out to more homes in a week's time. We've also focused on that person-centered care plans. We are bringing AI into developing our care plans for us, which is exciting at this point. And then our technology, our Homewatch Connect technology has allowed for increased touch points with the client and their loved ones, their providers, their doctors, their nurses, and the local Homewatch office. Also, as Curtis mentioned, this has led to an increase in family connections, which helps keep that person safe and not lonely or isolated.
Some of the great results that we've seen from our beta testing is the impact it has on the caregiver itself. As you probably know, the industry can have a higher turnover of caregivers. Well, we're able to guarantee them a set amount of hours per day. And what we saw in the beta testing is that the turnover from our caregiver staff reduced by 40%. As Todd mentioned earlier, the virtual visit opportunity, so it allows for some career elevation by having caregivers be a part of that virtual visit from their office. What we've also found is that of the clients that have used the technology, over 50% of them mention that they feel less lonely and isolation in their home. The client loved ones also have reported a stronger sense of peace of mind. Again, using the example of someone living 5 states away from their parents, it gives them a peace of mind in knowing that they have those virtual visits and that ongoing care inside the home as well. Of course, and we also have found, which is huge from a medical standpoint and hospitalization standpoint, is that the reduction of emergency room visits have decreased by 42%. The idea behind the total care solutions, by paying also in advance where the states can allow for that, is to provide the care based on when the client needs it. So that's determined during that time. And what we've found in the past is that clients would often cancel shifts. Well, now they have that peace of mind in knowing that the family has that peace of mind in knowing that their loved one's going to receive care, although mom and dad might decide, I don't want a caregiver in the home today. So that we've seen a reduction in canceled shifts, so people do receive that level of care they need. And of course, the average length of service that we provide to a client, because as Todd mentioned earlier, the active care allows us to start home care sooner, and then throughout our suite of services, we're able to keep a client under our care longer, so they're able to continue to age in place where they call home.
So we're extremely excited that we launched our technology vertical called Homewatch Connect. If you want to scan the QR code, it'll take you to the video to show you our technology. It's about a 2-minute video, so it's too long for us to play here today. But we have about 12,000 clients that are in our care every day and about 25,000 caregivers that are out there. So our technology really is focused on connecting and engaging and keeping that client monitored and safe at home, changing lives every day. Thank you.